Hi, my name is Lisa Santoro, and I'm a massage therapist at the Lydian Center and a certified infant massage instructor. And one of the things I'm going to teach today is this is an infant massage move called the water wheel. It's a really nice move to do when you've just come home from work, or maybe your baby has had a rough day, maybe the baby's been colicky, or maybe it's just a nice thing to do just before your baby's going to go to bed. So this is also can be done in the bathtub. And what we're going to be doing is we're going to be working the front end of the baby, or the anterior side of the baby, and it's really a whole body move. Just one word about pressure. We're going to be working very, very gently. We don't need to use any oils or lotions. A lot of times if we do that, the lotion can get on the baby's hands, and babies do generally put hands and feet in their mouth. So I just usually do this without any oils or lotions. In the bathtub, this is nice because you'll have a little bit more slickness with the water and maybe some soap if you're using any soap with your baby. So what I'm going to be doing, I'm going to start right at the sternum. If you feel your own sternum, it's your breastbone right here, right underneath the chin, not too high, but just about here on you and on your baby right here. And what I'm going to do is I'm going to drag my hand just very, very gently. Not too gently so that it's ticklish, but with a little bit, nice, firm, solid hand. Just the weight of your hand resting on your baby. And you're going to look at your baby in the eyes and watch their expression while you're doing this. Usually a baby will tell you if it's not okay. They'll start moving around, they'll make unhappy faces. That's probably a cue to stop. But we're going to assume that this baby loves this. So I'm going to start right at that breastbone, and I'm going to drag my hand right down the body and right up on through up towards the feet. And you'll notice I have my baby on a pillow. You can also do this on your lap, although it might be a little bit low for the baby and the head can point a little bit too far down. That's why I'm doing it on the pillow. If you have a boppy pillow at home, those work perfectly for this. So I'm just going to drag one hand, and why this is called the water wheel, one hand follows the other. So as soon as one hand is at the feet, the other one comes down. At no time do you want to have no hands on the baby with the baby in this position. So I'm going to follow one hand to the other, watching the baby's expression, and my baby looks like she's asleep, but your baby may be making cooing noises and happy baby sounds. You can also sing to your baby while you're doing this, a lovely thing to do. So if your baby's been agitated, has been crying, this is a really, really nice way to calm the baby down. And by looking at your baby, you're also making a nice connection with your child. And this is a nice thing to do right before bedtime, so that the baby equates going to bed with a pleasurable experience. And this is a nice move to do on the baby's back. I'm going to be working, there are two sets of muscles that run alongside the spine for us. They're called the erector spinae. They're postural muscles. And as your baby starts lying on their tummy and lifting up, the baby is actually creating their cervical curve in their neck. This can also create a little bit of tension on their back. You may have noticed this. If your baby's on the belly and they start bringing their head up, you can actually see these muscles start popping out. They're developing the curves of the spine. So this is a really nice way to sort of give them a little relaxation for that. So I'm going to put my baby over my shoulder, hold at the hips, and what I'm going to do, so if you can envision where the spine is, we're going to be on either side of the spine. And I'm going to start with very small circles. I'm using the finger pads, this part of my finger right here. And I'm going to make small, gentle circles on one side. And again, we're not using a lot of pressure here. We don't need to. You'll start feeling where the delineation of that muscle or the edge of those muscles are. I'm going to come down into the hip muscles because the baby is going to start kicking their legs. This is very good for relaxing the whole back of the baby. So again, I'm going to go one side, and I'm going to move my hand just so you can see what I'm doing, but generally I would really have a good solid hand there to hold on to the baby. So I'm going to work one hand here. I'm making small, gentle circles. And again, I'm not using any lotion or oil. For the back, you can use a little bit. This can also be, you can also work with baby powder if you're using any powder in the diaper area. So I'm going to switch hands. I'm going to put the other hand over that hip just again for stability. And I'm going to work the other side. So I've done one side, I've done the other. You can do a couple of repetitions of this, as many as feels good. And this may put your baby to sleep, which isn't that fantastic? So that the baby starts equating relaxation with playing music. They'll start knowing this is the time I go to sleep. It's time for me to wind down. And you can end that session with a nice, smooth down the back. This is natural. We all do this for our baby. We give them a little pat. But we really want to calm the system. We're not stimulating their system. So nice, smooth out. So those are finger pad circles. Just like this. Holding, you can rock your baby while you're doing this as well. Finger pad circles, one side and then the other.
So finally, I'm going to share some suggestions from my own field, which is homeopathy. Homeopathy is a system of natural medicine which is part of the national healthcare system in many countries around the world, Canada, Europe, India, South America, and its safety and effectiveness have been demonstrated by 200 years of use on millions and millions of people around the world, including babies. So I'm going to start with probably the favorite homeopathic remedy, and here we have it in what we call the blue tube. This remedy is called arnica, and arnica is probably the most widely used remedy because it's used for bumps and bruises, sports injuries, pulled muscles, especially bangs on the head. I remember using it once. I had a friend whose little girl, his little 4-year-old, came running full tilt into the living room, slipped on the rug, tripped on the dog, banged her head full force on the corner of the piano bench, and within 15 minutes she had a goose egg the size of half a baseball. We gave her arnica, and the goose egg disappeared in the same amount of time. So the same thing, if you think about that kind of head injury, think of what the baby goes through in the birth canal. It's being pounded and pounded, the head pounded against the mom's pelvis, and then the bones of the head being pressed together. You know how sometimes babies come out looking kind of like a cone head because the bones have actually been shifted? And sometimes the baby even has a little bulge on one side of the head. It's called a hematoma that looks like a great big bruise on the side of the baby's head. These are perfect situations for arnica. But the thing is, the arnica is also really useful for the mom. Think about bruising, soreness, swelling. If there's a vaginal birth, the mom has a lot of soreness and bruising in the vaginal area. And if there's a cesarean, we actually use arnica after surgery. It reduces bruising, soreness, and swelling after surgery. So chances are both mom and baby are going to need arnica. Now, if the mom's breastfeeding, that's really ideal. You can get arnica 30C, that's the potency or strength. Take a couple of pellets 2 to 4 times a day. If the mom takes it, dissolved in the mouth, it's going to go through her breast milk to the baby. But what happens if the baby needs a remedy that the mom doesn't need? What you can do is take one of those little pellets, crush it with a spoon, make a little powder out of it. You can either put a little bit of powder in the baby's mouth. It's not actually meant to be swallowed. It works as soon as it touches the mucous membranes on the inside of the mouth. Or you can dissolve it in a little water. Dab a little water on the baby's lips, or even put it on the inside of the wrist, put it on the baby's temples. A couple of options. Okay, here's another one. If you're going to be the healer in every home, in your home, you want to have a few things in your medicine cabinet. Probably the first thing is arnica, and the second thing is called rescue remedy. Rescue remedy is a blend of 5 different flower essences. Not exactly homeopathic, they're like kissing cousins to homeopathy. So they're a blend of flower essences that are meant to help with any kind of shock or trauma. It could be physical, emotional, any kind of shock. Let's say your older child falls off her bike. You might use arnica for the bump, but you might need rescue remedy because she's crying and she's upset. Or let's say there's an older girl who gets dumped by her boyfriend, rescue remedy to the rescue. Or maybe another teenager is in a car accident. Maybe anybody that hit their head needs arnica for the bump. Of course, while they're on their way to conventional medical care. But in the meantime, everybody's really shaken up. Perfect situation for rescue remedy. So think of the baby coming into the world. Eve described going through the birth canal and then, whoa, out into the world, bright lights, whacked on the back, take a deep breath. This is quite a shock for the baby. Rescue remedy is great, plus the mom's been through a lot too. So rescue remedy, it is in an alcohol base, so you probably don't want to put it right in the baby's little mouth. But what you can do is dab it on. You can actually rub it on the baby's forehead, and that's what's recommended in this wonderful book, which is by our colleague Miranda Castro. This book is called Homeopathy for Pregnancy, Birth, and Your Baby's First Year. And in this book, you're going to find out about many, many, many other things that homeopathy is good for. You may have a baby with colic, a baby with diarrhea, constipation, urinary retention, a baby that's restless, anxious, fretful, can't sleep. Many different things homeopathic remedies can be used for. So many different remedies, we can't really cover them all in this show. So we're going to recommend that you have arnica and rescue remedy on hand, that you pick up a copy of this book. We have Eve has written a wonderful book called Rapping on the Reflexes, and that's about something she practices called infant reflex integration. Not just for babies, it's for kids of all ages. It's wonderful. Kids love it. Any parent can do it with their kids to help brain development and coordination. So my parting thought for today, we called the show Take a Deep Breath, not just for the baby coming into the world, but also for the parents. New parents tend to get really anxious. Babies don't come with operating instructions. New parents tend to feel, I don't know what I'm doing, I might do something wrong, I might do something to ruin my baby, what am I doing? So here's the thing, take a deep breath. Worrying doesn't help. The most important thing you can do for your baby is to love your baby. Feel your heart, feel your baby's heart. Feel a connection between the two. Feel like you're breathing in and out with your baby. As you breathe out, send love to your baby's heart. As you breathe in, feel like you're breathing in the essence of your baby into your heart, and you're creating like this little nest for your baby inside your heart, this safe, loving, supportive, nourishing nest. Babies need good food, of course, but they also need love. It's a different kind of food, and you can always do that. So that's our parting thought. Thank you so much for joining us for A Healer in Every Home. For more information about natural healing at home, with DVDs and online courses, please see our website, greenhealing.org. This excerpt is from our show, A Healer in Every Home. You can see more clips on the Green Healing TV channel on YouTube. Please help us to spread the word about how families can use natural healing at home. Ask your local community access station to air A Healer in Every Home. They can easily download it from PEG Media. Thank you.